Spinal cord stimulation is a minimally invasive procedure in which we place a wire into the epidural space of the spine to help block pain signals from reaching the brain. The goal behind spinal cord stimulation is not only to improve pain, but to improve the patient's function and to decrease their reliance on medications. Patients who are candidates for spinal cord stimulation are generally those candidates who suffer from neuropathic or nerve pain that radiates from a neck or back down an arm or a leg. These patients have generally failed more conservative treatments and in many cases have even failed spinal surgery. The spinal cord stimulation is performed as a trial procedure first. This is performed under X-ray guidance and generally takes between 20 to 30 minutes. You actually place an electric wire into the epidural space. This is performed using X-ray guidance. The procedure is performed with a small amount of sedation. After the procedure, the patient is instructed on how to use the machine, and they go home and use the machine for anywhere between 3 to 7 days, depending on the patient. When the patient comes back for removal of their temporary spinal cord stimulator trial, it's removed in the office just by pulling the wire out in the exam room. Depending on how much relief the patient obtains, we will discuss implantation of the permanent device. A patient who is a good candidate for implantation of a spinal cord stimulator is a patient who obtains greater than 50% improvement in pain, improvement in quality of life and functionality, and decreased utilization of pain medication during the trial procedure. Spinal cord stimulation generally works by confusing pain signals that go into the spinal cord before they reach the brain. As with any surgical procedure, spinal cord stimulation has risks such as infection or bleeding. In addition, there is risk of injury to a nerve root or spinal cord injury or spinal fluid leak causing headache. I've done hundreds of procedures. It's very rare to have complications from the procedure as well as post-implantation of the device. Follow-up after implantation of a spinal cord stimulator is generally 12 to 14 days after the procedure. During that follow-up visit, staples or sutures are removed and the device is programmed with the help of the representative from the spinal cord stimulator company. We generally do place some restrictions on patients after the device is implanted. These restrictions are generally limitations with lifting, bending, reaching, and twisting for about 6 weeks. Even though the spinal cord stimulation device is sutured into place, we generally like to wait about 6 weeks for the device to scar into place so the patient can perform more aggressive activities. When you implant a spinal cord stimulator, you implant not only the electrical wire that conducts the electrical energy to the nerve root and spinal cord, but you implant the battery. Patients have two options between spinal cord stimulator batteries: rechargeable and non-rechargeable batteries. The rechargeable batteries generally last 9 to 10 years before they have to be changed out. Non-rechargeable batteries can last anywhere between 2 to 5 years depending on how much energy the patient uses. The majority of patients decide they would like to have rechargeable versus non-rechargeable batteries because they do last longer.